think it's really important that women understand that there's a level of expertise that's required to do breast imaging. There are some very subtle findings that it takes an expert eye to pick up. The other problem with going to a more general setting, and I want to say that a general radiologist who does a lot of breast can do breast very well and can stay current in the field. But a general radiologist who is not reading a lot of mammograms and who hasn't stayed as current as a breast expert is more likely to overcall things. They're more likely to recommend biopsies that may not be necessary, and they're more likely to recommend additional follow-up films. So the chance that a woman can have what are called false positives, which means that the test came back with a result that needs more workup. A false positive means that you're working up something that probably doesn't need to be worked up. It's probably normal for that woman. The chance that you can have a false positive in that general setting is actually much higher than in an expert setting. And the same thing goes with other forms of breast imaging like MRI and ultrasound. Breast is a field where you really need to match the findings on the mammogram to the findings on the ultrasound to the findings on the MRI. And all too often I see general radiologists who are not passionate about doing breast correctly, not referencing the recent mammogram or the recent MRI when they're reading the other test. And they really go hand in hand. You cannot do good breast imaging work without really comparing all your modalities.